Hello, everyone. My name is Darlene Gaynor. I am a urologist for MidLantic Urology, and thank you very much for this opportunity to speak to you about bladder control issues. Bladder control issues can feel like sometimes it's controlling our lives, so it was nice for MidLantic and all of you to invite me to give a talk. Here's some information about me if you want to read or look at your slide deck later just about my education. I was educated in Chicago at Cook County Hospital and University of Iowa for my fellowship, which deals with neurourology and urinary dysfunction and reconstruction for females as well as males. Anyway, so I'm located at our Wynwood office, also in Broomall, and people come from around the state and sometimes different states as well. And I'll go through much of what I cover, and if you have any questions, feel free to use the question box so we can review anything maybe I may have missed out on. So basic anatomy, you have two kidneys. They're in the upper back sides, and they drain into tubes called the ureters, and then it drains into the bladder. And women have a small urethra where the urine comes out of, and men have a longer urethra because they have a prostate, and men and women can have different types of urinary issues. So depending on the issues, different people are treated differently. So overactive bladder is extremely common. It affects 50 million people in the United States, men and women. And about a quarter of these people suffer from incontinence. And it's important to understand that there is a stress incontinence where you cough and sneeze and leak, or if you had a prostate taken out and you bend over, you can leak that way. That's more mechanical. And then there's like the other side, which is urge incontinence, and that is more nerve related, where the bladder can spasm. And they're two different paths, and they're treated differently. And some people have both issues. So there is, with overactive bladder, you have that sudden need to urinate. When I'm teaching our medical students and residents, it usually consists of like an urgency that's strong, feeling like, oh my God, I've got to go. Or frequency, when you're driving between your home and work or going out socially, and you know where every single bathroom is. Or when you used to go to the mall, you would know where every bathroom is. And then how many times you get up at night. Getting up 1 to 2 times a night is normal. More than that, it starts to affect your REM sleep and getting a good night's sleep. It is normal to urinate up to 8 times a day. Going to the bathroom during the day, such as like every 2 to 3 hours, is normal. We really don't want to urinate more than 4 hours, unless of course you're sleeping. So let me just continue here. So incontinence is where your bladder leaks. Normally, your bladder shouldn't leak. You should just urinate in a controlled manner. Stress incontinence, it's not like stress for heart. It's stress where it's the abdominal pressure overcomes the bladder pressure with a cough or a sneeze or lifting, and your urine just can start to come out and you require pads. Even some women during intercourse could have some urinary leakage as well. So basically, you have that strong urgency, and then you have to run to the bathroom, and you can't control this symptom. It's more common in women because, like I mentioned before, the urethra is shorter in a woman than in a man. And then overflow incontinence, we actually see that more often in men. The prostate can obstruct the bladder, and then you have the overflow of urine that leaks out. Women can have this if, for instance, you've held your bladder for several hours for several years, and your bladder's just stretched out, and that thin muscle of the bladder just cannot contract anymore. So there's a storage issue with the bladder, and then you have the opening issue as well. So basically, different things, the overflow incontinence is treated differently than the urge incontinence or the stress incontinence. So what causes the bladder control problems? When you urinate, the detrusor muscle contracts and pushes the urine out of the bladder. And then beforehand, the urethra, where you urinate from, it allows the urine to come through normally. And then when you're having problems where the bladder's spasming, it could be a bladder cancer, which we don't usually mention that first. It's usually maybe inflammatory or hormonally affected, and commonly it may have nothing to do with bladder cancer. The fact that bladder cancer is mentioned, I just want to mention briefly, if you have blood in your urine and there's no pain, there's no urgency, typically that's more of a bladder cancer issue. The overactive bladder, like I started to mention, is a nerve issue, a hormone issue, and it could also be an infection issue. Diabetes can be associated, especially if it's undiagnosed diabetes. As we get older with hormones, for instance, with women, we have a depletion of estrogen and progesterone, and then the bladder can start to spasm because the blood flow just isn't coating the nerves like it used to because the depletion of the hormones. And then with nerve issues, there can be spinal stenosis, there can be herniated discs, and these things can directly affect the bladder because the nerves are innervated in that manner. So what causes bladder control problems? There are, of course, medications there's antidepressive medications, especially older ones. Alcohol, caffeine, all those things can directly irritate your bladder. Even artificial sweeteners, spicy food, tomato-based products sometimes. You sort of have to see what does cause a flare. There can be some increased pressure with weight gain, and that pressure from the abdomen onto the bladder can cause increased stress incontinence, that mechanical type. And sometimes, just telling a patient lose weight isn't the trick, but to actually, take care of the problem, then the patient can exercise, is something that can be discussed. There's neurologic issues like Parkinson's. We know bladder spasms tremendously with Parkinson's disease or multiple sclerosis. Strokes maybe initially, but not always does a stroke have a long-term effect on the bladder. Pregnancy and radiation, and of course surgery and infections, like I briefly mentioned before. So when we want to try to identify what's wrong, we of course want to check your urine and make sure there's no blood and no sign of infection. Maybe we'll have your bladder filled and have you cough and see if you leak that way. We even have an EKG of the bladder called urodynamics, and a tiny little catheter is placed in the urethra, tiny little one in the rectum, and there's a computer, and we fill up the bladder and see if slowly, and it doesn't hurt. It takes like 20 minutes, and it is a standard way to see, okay, is this the stress incontinence or is this the overactive bladder type of issues going on? Sometimes we do need to look inside the bladder and make sure nothing else is causing these symptoms. And then what's really nice is in our office, we have a little ultrasound machine, like checking for a baby with a little jelly, and we see how well your bladder empties, which I love that little device. Anyway, we typically get CAT scans if we're worried about kidney stones, or if we're worried about blood in the urine and things like that. So the EMG, those are little stickers during that EKG procedure, the urodynamics. And that will tell us if you have pelvic floor dysfunction, if it's too taut. And that's good to know, because sometimes we tell people to do Kegel exercises or exercises that could even tighten your bladder, your pelvic floor more, and we don't always want that. A bladder diary that you can keep on your own is very helpful. Just writing, jotting down the time, jotting down how often you're urinating is a good objective way of knowing, hey, is this something that's really recurrent and frequent, or how often are you leaking? So that can be very helpful, as well as to your urology staff and providers. So we have multiple different options. Matter of fact, one of the reasons why I did a fellowship to be an expert in this area was so that I had more than just medications to offer people. So we'll go through some things here. So, of course, the evaluation, like we had already talked about, the history and physical. So we want to do some certain conservative treatments, for instance, and make sure that you're not drinking a lot of fluid before bedtime. For instance, stop drinking 2 hours before bedtime if you're getting up 3, 4, 5 times a night. But definitely drink those fluids earlier on in the day, because you need those, ideally 8 cups of fluid a day, clear fluids ideally, never less than 6. So diet and avoiding those irritative food products or alcohol and things like that I mentioned before, and the caffeine. Exercise helps blood flow. Exercise actually does help so much, besides Kegel exercises or the pelvic floor exercises. It's the same exercises that if you ever hear the doorbell ring or the phone ring while you're urinating, and you try to slow down your stream, your urinary stream, or stop it even, or for a man, if you can squeeze those pelvic floor muscles, the penis actually can go up and down if you're doing these correctly. You don't practice when you urinate. You practice at a red light or when you're sitting or standing. And you could do like 5 sets of 10 squeezes. And in 2 weeks, you could be better. We have physical therapy. We have biofeedback. A lot of tips and tricks and things like that to try to help. So medication has been around for decades, such as what we call anticholinergic medications like ditropan or Detrol. And there's brand names, there's generic ones, and they have been tested for a long time. The generic ones are the ones we typically worry about memory loss issues. I've never seen that happen because a lot of, or majority, or all of the medicines are new and improved, and they don't cross the blood-brain barrier to cause those problems. But commonly there can be some dry mouth. There can be some constipation. If you have any vision changes, of course, we want you to stop those medicines. And there's even a newer class of bladder medicines like Myrbetriq or Gemtesa. And we just want to make sure you don't have signs of like a headache or high blood pressure. And so that's why we just check and make sure you're doing perfectly fine. We start you on low doses, but after we've tried medications, insurance does pay for us to offer other options for you. Before I go on to the minimally invasive options, there are vaginal pessaries. So that's like a giant diaphragm that may or may not help compress the urethra. They can be about 50% successful. You can't keep them in if you're sexually active. You have to take them out. Your tissue has to be monitored. There is a urethral insert, not as commonly used. It's a little insert, like silicone type plug that can go directly into your urethra. If, for instance, you're jogging and leak but it isn't to stay in regularly. So there are minimally invasive options. So one of them, for instance, is Botox. Botox is the same type of procedure that would directly be injected into the bladder. It's the same Botox for wrinkles, or FDA approved for headaches. And Botox is FDA approved since January 2013 for bladders that spasm. There are risks with that. It may be a urinary tract infection or not emptying your bladder completely. Those risks can be avoided or are low. The other thing is, as this slide is showing, sacral neuromodulation. And so sacral neuromodulation has been FDA approved since 1997. It is about 95%, it offers up to 95% improvement. This is one of the reasons why I did my fellowship, besides other things, so that we have a device that can help you without medications, without the side effects, and with very low risk profile. They used to last about maybe 5 years. Now they are MRI compatible. It's like a little chip that goes under your skin, but there's just a test you could do first for a few days with a little wire that's taped to your back. And if it works for you, yes, insurance does pay for a device that lasts now 15 to 20 years and MRI compatible. So it has been new and improved. And then we also have like an acupuncture type of procedure. We also have studies within our company whereby a little needle, like an acupuncture needle, goes right near your malleolus at the ankle area. And it can stimulate your bladder function because the nerves that run from the sacrum, the lower back, to the bladder also affect certain areas of your feet, your great toe, things like that. And that's a procedure that's done once a week for like 25, 30 minutes. And after 12 sessions, even before that, hopefully after about 4 to 6 sessions, you should notice improvement. You would have to do all 12 weeks. And some of our sister offices provides that option. And then there are so those things were for overactive bladder, urge incontinence, the nerve type of issues. So for stress incontinence, the coughing and leaking, we have slings, which are the standard of care for stress incontinence. We have slings for men. We have slings for women as well. You have the choice of the standard of care, gold standards, polypropylene mesh material. It's not what the lawsuits were about. Those were kits that were larger kits. For prolapse, but these slings are very tiny amounts of mesh material. It's about 85 to 95% success, even looking at 20 years of studies of stress incontinence. We can also use your own tissue and harvest your tissue from like the side of your leg with a tiny incision, and then we can also support the urethra and compress it in that manner. There's also a way we can do that with an abdominal approach or robotic approach. There's also an artificial urinary sphincter. We typically use that more often for men who have had, for instance, a prostatectomy or a trauma, and that compresses the urethra, and there's a balloon release if you have to urinate. And those are options as well. The Botox I had mentioned previously, the risks of the Botox is given typically twice a year. It can be done in the office. Some people like to have a little Valium or pain medicine, but you don't have to go through the whole rigmarole of the operating room. But many of these procedures are simply done under twilight, even if you do go to the operating room. There are injections that we can place into the urethra so that you don't leak, especially if you're not ready to do a sling procedure. That may take a few minutes, whereas the sling procedure could take 20 minutes. The Botox takes about 2 minutes after some numbing medicine. Just to go back on the Botox you can give an antibiotic to help prevent urinary tract infections and things. Some people need a catheter after if you can't urinate right after, but the risk of that is typically less than 3% most of the time, depending on the patient. So there is also a mention of this bladder augmentation. This is very rare that you would need a major surgery to enlarge your bladder. For instance, we can use bowel and take a little piece of your bowel and use it as a patch to attach to the bladder and make your bladder larger. There's no 100% guarantee that always does the trick, but it's so wonderful that our minimally invasive options that I previously went through are typically the most successful and standard of care. So let's see if you have any questions. I'd be happy to answer. I have 8 definite questions here. Let's see. I can do it in order. So, I drink 8 glasses and 8 ounces. So when should I stop to get up 4 times at night? Now, like I had mentioned, you should get up really ideally only 2 times a night, and you should ideally stop drinking fluids 2 hours before bedtime. If you have any swelling in your lower legs, then try to elevate them above your heart before bedtime. Drink your 8 cups of water earlier in the day. Let's see. Let me just do this. When doing Kegel exercises, how long should I hold the contraction? Very good question. Really just 2 or 3 seconds. We call them quick flicks. Just hold, relax completely for a couple seconds, hold again, relax completely, and do them no less than 30 times a day, but I'm sorry, no less than, you do like 5 sets, 10 squeezes at a time. In 2 weeks, you should notice improvement. At 2 months, that's just where you're at. How much of a reduction of alcohol and caffeine? I mean, the caffeine, of course, you need your coffee or something in the morning. Expect that you may have to go more frequently. Even if you're on a diuretic or a water pill, expect for a few hours you may have to go more frequently. But after that, you should be better. Number of times one should urinate daily. It really shouldn't be more than 8 times. You shouldn't have to go every hour or even every hour and a half. You should be able to go like 2 to 3 times a day. But, don't go longer than 4 hours. So yes, that 3 hours is really good. And then alcohol, if you drink your 1 glass of wine a day, then that's what you do, and expect that there's a diuretic effect. It's best to have it maybe during dinner and not, an hour or 2 before bedtime. And then likewise, no urgency when I was in a book, TV, then urgency the minute that distraction is, again, it's not necessarily psychological or physical. If you feel like you need to, you're distracted, it is a form of overactive bladder where the hormones are affected. And we do have medication. You can do 10 quick flicks, 10 of those Kegels when you feel that urgency coming on. You can also, try to make sure you have time voiding where you urinate every few hours. And urinating 3 to 4 times a night, even with diabetes, it may not necessarily be from the diabetes. It could just be maybe your bladder's not emptying completely. Maybe you just have overactive bladder. End stage diabetes is where you've had it for several years and your bladder's just not emptying. If you have treated diabetes, things should normalize typically. And then let's see. If a male experiences urgency mostly when almost going to the bathroom, when getting to the home front door, to the bathroom door, is that cycle? It is called latchkey syndrome. We even have that in our textbooks. This is all part of overactive bladder, and sometimes you may leak, or you're just trying to get to the bathroom, or you're washing dishes and you're just not making it. It could be a combination of, if you're a woman, of stress incontinence, where the opening of the urethra just isn't closing enough. You have that spasm and it's going to leak out. But overactive bladder with urge incontinence alone could cause that. And then let's see, if a male experiences urgency mostly when almost, okay, I had already answered that. With the men, it could just be the prostate. Often the medication for the prostate to open up the urethra, like Flomax, if you've ever heard of it, an alpha blocker, that may just completely take care of the frequency and the urgency and the having to get up to go to the bathroom at night. So sometimes that may be the first thing I do, is treat the prostate in a male. And if the symptoms go away, great. If not, maybe you do need an overactive bladder medicine. Maybe your bladder isn't emptying completely or enough. Your bladder doesn't have to empty completely. It may be half full and you don't know it. But if it's very full, we want to know about it. So let's see. Often when relaxing, going also in men, what may cause urinating and soon after the need to urinate? You may have just the overactive bladder, the prostate, even a cold breeze in the groin. That is overactive bladder. Men can have overactive bladder as well. Even younger men may have a high riding bladder neck and have a small prostate, and it is maybe the bladder neck is too tight. That's a primary bladder neck obstruction. That's treated differently, and medicines don't always work for that you would use for the prostate. But the overactive bladder medicine it can be very helpful, just so your bladder empties okay. The irritative food, once again, is the alcohol, spicy food, caffeine, artificial sweeteners, things like that, citric acid sometimes, but maybe these things don't cause that. So you just have to try to look. Like I said, stress incontinence and overactive bladder is possible. In a man, we typically only see stress incontinence, where where you're just bending over and leaking, is if you've had a prostatectomy and the prostate's been taken out, for instance, for like prostate cancer. Or if you've had radiation, you definitely could have like overactive bladder. If your bladder empties halfway, so if it doesn't bother you and there's like 200 or 300 cc's left in your bladder and it doesn't bother you, fine. Just so your bladder's not filling and you're not, and your bladder isn't overly filled. It is important to urinate, like I said, every 2 to 3 hours, and not have to get up more than 2 times at night. And then someone asked about the Lasix, the water pill, like I had said. Maybe you could just take, instead of 20 milligrams 2 times a day. If your blood pressure doesn't go too low and your cardiologist, not your urologist, but your cardiologist says it's okay for you to take the medication only in the morning, then you may have just 3 hours of issues with having to go, and the rest of your day may be better. And if your bladder empties fine, we can also give you an overactive bladder medicine or a pacemaker for the bladder, basically like I had spoken to you about, a chip under the skin. How many times a day should a person urinate? I had said that. I drink 8 glasses of water. When should I stop to keep getting up 4 times a night? I had said that 2 to 3 times a day. I guess there's more questions. Let's find them. I heard that you should drink half of your weight in ounces. For me, weight. Yeah. So if you're trying to lose weight, it is good to drink a minimal amount of fluid, like 8 cups of fluid. We don't want you to drink too much, because if you're only drinking water, there's no salt in water. And then you could start getting dizzy, actually, if it's like, a gallon or more of plain water. It is good to drink Gatorade or, tomato juice, and make sure you're having enough minerals, different minerals. But you just make sure you drink your 8 to 10 cups of clear fluid. You should really 2 to 3 liters, and that's like 8 to 12 cups of fluid a day. If lemon activates your bladder, then don't take it. Try it for a couple of weeks. Try not taking it for a couple of weeks. See if you're better, and if it makes no difference, then keep having the lemon in your fluids. What are methods to decrease urinary retention? You can crede, meaning push above the pubic bone. Above your genitals is that hard bone, the pubic bone, and you can push. And we don't always want you to strain when you urinate. We want you to relax completely, maybe put your hands under warm water, and then urinate. And you, like I said, you could crede and push while you're urinating, push with your fingertips, and that may cause a spasm that allows you to urinate. You can urinate, wipe, stand up, put your hands under warm water, sit back down, and try to go a second time. Sometimes you are emptying sufficiently. You may still have 3 ounces of fluid in your bladder, but you're feeling them, and that is really the overactive bladder. And then someone, good question. How often are urinary and bladder or bowel problems seen together? So if you have constipation, you can have urinary tract infections. If you have constipation, it may be compressing the bladder. You may not even be able to urinate, or maybe you have to go too often. Let's see, what other questions? Is it typical that you get up first to go to urinate? Is it typical that when you first get the urge to urinate, it gets worse just trying to get to the toilet? Oh, yes. It seems like sometimes I leak just at the point that I'm just at the bathroom. Yes. And like I had mentioned, maybe hormones, like a depletion of estrogen, like it starts to like a decrescendo as you lose estrogen from the time of menopause, for instance. And it can get worse with time. And like I had said, pacemaker for the bladder, the medications, all these things can help. We have looked at estrogens, and it's really no definite studies that ever show that estrogen creams, for instance, could help that issue. You mentioned Kegels are not for everyone. It's usually for most people, to be honest. If you're like really tense and you have pelvic pain, do not do them if you have pelvic pain. And then you could be seen to address the pelvic pain issues. But otherwise, usually Kegels are very helpful. And then you don't usually do them wrong. You just hold for a few seconds, relax. We have professionals, pelvic floor therapists. They're typically females. Once in a while, they can help men as well. They help with pelvic pain as well as with Kegels. With regular overactive bladder, as well as stress incontinence. Our nurse practitioner at our particular office helps with biofeedback. A probe is placed vaginally. It helps reset the nerves, and it really helps you do the Kegels properly, even if you go once or twice. I mentioned the hydrochlorothiazide is like Lasix. It's a water pill, like I mentioned before. Yes, tamsulosin, Flomax definitely helps the bladder empty most of the time. If you're still feeling like you leak and you have to get to the bathroom, then you may need something else. Maybe your bladder's not emptying completely. Maybe the bladder neck's too tight and the medicine isn't going to help. Maybe you need an overactive bladder medicine. Maybe you need a pacemaker. Pacemaker sounds kind of, it's just a little chip and a wire. It's actually simpler than what it sounds. Yes, finasteride definitely causes erectile dysfunction in males, or Proscar. It can grow hair though. Situations where I may be anxious, you have to urinate more. Absolutely. That is overactive bladder. And we have medicines, or we have, time voiding or behavioral things that you always make sure you urinate before you leave the house. I think I learned about that anyway in residency, because God forbid you're in an accident or anything. You don't want your bladder full. But that's overactive bladder. Artificial sweeteners, sodas, absolutely can cause urgency. I mean, if it doesn't affect you and you're fine, then God bless you, fine, drink and be merry. Have you encountered men who have their prostate removed continue to have some incontinence when there is stress? Absolutely. Anything you can do to improve and lose urine, 100%. We have male slings during my fellowship. That's what we did, multiple, male slings often, and they've been new and improved. Same type of sling like a woman has. Multiple different urologists, or a few urologists in MidLantic, do perform that male sling. Depending on if you've had radiation, depending on how badly the incontinence is, sometimes you need a artificial sphincter which encircles the urethra, or you just need a sling. And these slings stay in place permanently for like 20 years, and they can be very helpful. If you're bending over and leaking, that is stress incontinence, unless it's just overactive bladder and your bladder's spasming. But if you've had a prostatectomy, it's usually stress incontinence. We even are trying the little urethral bulking agents like Bulkamid, or a little injection, and that may help. In the past, it wasn't that helpful with studies, but now with this new hydrogel, it may close up the urethra enough, even in a man, to decrease the incontinence. So they're all minimally invasive. So can sleep apnea contribute to urinating too much at night? That's a very good question. So with cardiac issues, if you have extra fluid on your heart, that can contribute to urinating more. Sleep apnea causes you to get up if you're not using your CPAP device or something similar. And then you're just getting up, and then you're like, well, I'm up, I should urinate. Unless you are getting up because you must urinate. Say you have the CPAP and you're using the CPAP because it can add 5 years to your life, and you're still feeling like you have to urinate, then it could just be overactive bladder. And we have things that can help with that. So if nobody else has any questions, I really am glad everyone had excellent questions. I hope I covered as much as possible in this somewhat short duration. A lot of this is what I do tell my patients when they come and see me in the office as well. At MidLantic, we have many of us that can help specialize in these things to help you so you can live your life, because although it's not the heart, it's not the lungs, these things could snowball into weight gain and into these other issues that affect you socially. And then patients don't even want to go out, and that contributes to depression. So these are, very important areas. Some people are afraid to discuss these issues, or sexual dysfunction as well, or all these things that are extremely important issues in one's life. And we don't want it to become cardiac issues, and because you don't want to exercise and things like that. So thank you very much for your time. I hope all of this helped. And I think you have the slide deck, and that would do it. Thank you so much. And I think that is it. I think that's, let's see. That's all.